Assalamu alaikum, the communication day. First scenario, Mr. Ahmed, 60 years old. Your role is senior house officer in the neurology clinic. Mr. Ahmed was admitted 3 weeks ago with weakness affecting the left side of the body. He is known to be hypertensive for many years, but not compliant to the medication. ECG revealed AF. Your consultant decided to start him on Apixaban, lisinopril, atorvastatin treatment for secondary prevention. Your task to explain to Mr. Ahmed the situation, counsel him about the disease and the importance of taking his medication. If you're ready, Dr. Salma, you can start.
Yes, I will try. Hello.
Hello.
Yes, my name is Dr. Muhammad. I am a doctor in the nerve clinic. Am I talking to Mr. Ahmed, 60 years old?
Yes, doctor.
Nice to meet you.
Nice to meet you, doctor.
We are here to discuss some issue related to your health condition. Is it okay with you?
Yes, doctor.
So during our conversation, if you want to ask any question, don't hesitate to stop me and ask me. I am happy
Okay,
to
doctor.
help and answer your concern.
Okay, thank you, doctor.
Okay. Do you want anyone to attend this meeting with you?
No, doctor, it's okay.
Before I start, can you tell me how much far you know about your condition?
Actually, doctor, I have my blood pressure is high, and from 3 weeks I have weakness affect my left side. And I'm admitted here, and doing for me a lot of investigations, and they tell me they will give me medication. So I'm just here to know exactly what I will have and what I must do.
Yes, it's okay. Yes, you have weakness, as you mentioned, affect your left side of the body, and you are
Mhm.
non-hypertensive. Um, and also, an ECG revealed that you have atrial fibrillation. You know about atrial fibrillation?
No, doctor, what this one?
That is mean your heartbeat is irregular.
Mhm.
Yes. And this is need to take medication to make it regular because if it continue irregular, many complications can happen.
Okay, doctor.
Like yes. So um,
It's a
it's
serious disease, doctor? It's a serious?
unfortunately yes.
Mhm.
It is a serious disease because many complications can happen without taking medication.
Okay.
Yes, like shooting impulse and um, many complications can happen without medication. So this is
Like
serious
what,
and
doctor?
also
Like what, doctor?
that
What you said?
shooting of impulse from يعني blood clot can happen
Mhm.
and can also close vein. So and also weakness can come back again
Mhm. Okay, doctor.
and can be more dense and more severe than the first one.
Okay. So what I must do, doctor?
You must take the medication regularly
Okay, like what,
to
doctor?
avoid the complication. Already you
Mhm.
have some medication with you, like
Mhm.
Apixaban, lisinopril, and atorvastatin. This is your treatment will be.
Oh my God, doctor, all of this? I cannot, doctor. It's too much, too many.
I highly appreciate your concern.
Mhm.
I am sorry, but you should take this medication. Without this medication, many complications can happen.
How I can remember, doctor, all of
And this
this
is this
medication?
is all.
On for what all of this medication? I know I come with
Okay.
hypertension, but a lot of medication now. Can you explain more for me, doctor?
Okay. Okay. I highly appreciate your concern. I
Mm-hmm.
will explain all. This is one medication called lisinopril. This is for reduce blood pressure.
Mm-hmm.
It's okay,
Okay.
because
Okay.
already you have high BP, صح? You have high hypertension, high
Right.
blood
Yes.
pressure. Yes. So you need to take lisinopril for hypertension, and you
Okay.
have also atrial fibrillation. As I explained to you, that irregular heartbeat, and many
Mm-hmm.
complications can happen from this. So you need to take also Apixaban to
Mm-hmm.
prevent
And
any blood clot will happen from as a complication of atrial fibrillation. You need to take one medication called Apixaban. This is Apixaban
okay.
can,
Mm-hmm.
yes, can also helping in resolve the blood clot, and
How, doctor?
also
How this
re-
medication
re-
can prevent from blood clot?
this this is like blood thinning medication.
Mm-hmm. Okay.
Yes, and also atorvastatin. Atorvastatin. This is medicine used to reduce cholesterol level in the blood.
But I don't have
This is
high
also
cholesterol, doctor.
this is what called prevention medicine.
Okay.
This will protect you from any clot, any something can close the vein, any something can any complication can happen
Mm-hmm.
by close the vein, so
Vein?
blood
What
cannot
mean
be.
by vein? Mm-hmm.
This is the vessels, this
Okay.
is the wall that blood go through.
Okay.
Wall that blood go through. This
Mm-hmm.
can be closed by something called clot.
Okay.
Okay,
And this
this
medication will
medication.
prevent? Okay.
Yes,
Okay.
this
It will
medication will
protect
prevent.
me from this one. Okay.
Yes, and protect you from also high cholesterol level. So
Okay.
this is called secondary prevention. This will
Okay.
prevent you from weakness. Is it
Okay,
okay?
doctor.
You are
And this
following me?
is
You are
yes,
following
yeah,
me?
yeah, 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 doctor. It's too many, but I'm trying to understand one by one. But you mean this medication, it will treat my weakness also? I will stay like this. I have this
This
weakness in my.
this
Mm-hmm.
I highly appreciate your concern. This
Mm-hmm.
medication will prevent you from another attack of weakness.
Okay. And you will
Yes,
give me something for my
and
weakness?
this for this one, I will refer you to neurology clinic, and physiotherapy will help you more about this.
We are already in what you mean neurological clinic, no?
Yes, yes,
Okay.
we will follow your condition with neurology clinic,
Okay.
and with, yes. But about this medication will prevent from another complication.
Okay. Clear,
You
doctor.
are following me?
Mm-hmm.
You understand my
Yes, yes, I'm trying, doctor.
explanation?
Yes.
2 minutes left.
You have any concern?
Actually, it's too many, doctor, but I will try to take it. I have because issue to remember the medication, so I will try to find something to help me. But
This is
doctor,
three tablets.
it's not too much to maybe there is side effect for medication, something like this. I'm scared to be honest, I'm scared to take medication to have a side effect,
I
so
highly
I
appreciate.
didn't take.
Yes, I highly appreciate your concern. Any medication has side effect, but benefit versus risk is very important. So the benefit you will talk more than the side effect of the medication.
Okay,
This is the best of interest for your condition.
okay, doctor.
Uh, can I ask you some social question?
Yeah, sure, doctor.
What do you do for living?
I'm a taxi driver, doctor.
Okay. Um, I will contact also. Do you financially support it?
I work. Yes, I'm fine.
Okay. Do you smoke?
Yeah, doctor.
Do you drink alcohol?
Yes.
Uh, have you any concern?
No, doctor. Thank you.
Thank you.
Thank you, doctor.
You have 15 seconds, Dr. Salma. What do you want to advise here regarding smoking and alcohol? Will she continue to drink
Yes,
and
yes.
smoke? Yeah,
No,
please.
no, no. I think time is finished. For smoking, I am advised to stop smoking. I can help you by referring to smoking cessation clinic. And also, I'm advising you to reduce drink of alcohol.
Okay, doctor. Thank you.
Okay,
Thank you,
time
Dr. Salma.
time is up. But what about driving? Shall we continue driving or shall here continue driving?
Should stop driving
Yeah, okay.
until yes, until
So
we
perfect,
find.
yes. Well done, Dr. Salma. Perfect. As a first time practice, it's perfect. You know how to answer, you know how to address the concern.
والله sorry يعني, but I
No,
didn't
no,
want
no,
to
no, no, it's
to
perfect.
cancel.
No,
Really,
thank you, doctor.
no, it's perfect. For me, you did great. Let's comment, hear the comment from Dr. Kinana, then I will comment.
Yeah,
Thank
thank
you.
you, Dr. Salma, because yeah, it's the first time, and uh, for the explaining, you use jargon sometimes, and a lot
Mm,
of times, and you must maybe start for first to explain the disease, what happened
mm,
exactly, then explain every medications with the side effects, and how it's important to use it, and
mm,
yeah, you try, but it's I'm asking you, so I'm asking sometimes also about side effects. It's important, and
mm.
maybe also you will explain more about the physiotherapy, or refer him, because he is in the your role. It's to work in a nerve or a neurological clinic. So you said you will refer him to neurological clinic. So I
Yes, I
feel,
mean
yeah,
consultant or specialist like this.
yeah, maybe yeah, for the refer for the physiotherapist, for maybe how it's important to comply on the treatments, and also about last the driving, and he cannot drive because he have this weakness. So yeah, this my complaint, but yeah, you make it great. Thank you, doctor.
Thank you.
Okay, thank you, Dr. Kinana, for the scenario.
Mm-hmm.
Now I will comment about the performance. She did well as first time, as I mentioned, but how to address every concern, I will try to make it as point by point, just to learn how to do it as perfect, Dr.
Yes.
Salma. But you did great. You answer every question, but you need to rearrange the ideas because
Mm,
you should start first, as Dr. Kenana said, to explain the disease. But before that, the introduction. Let's talk about the introduction. You introduce yourself, then you confirm the patient name and age.
mm.
Do you want to someone to attend? It's okay. Maybe she needs support or he needs support as a new disease or new diagnosis. So it's okay. You can invite. The next point, the background, if he knows about his background. Then he will tell you what I have, and if he tell you exactly what he has in details, so no need to explain more. Or you can ask him, you want me to explain more, as you did. So you told him something new here in this scenario, which is the AF. But let's talk about the expectation. You have to ask him about the expectation. What do you expect from this meeting? Any idea about what's ongoing? Then
Mm.
you can, from his expectation, you can address one of his concern. For example, he will tell you, Doctor, I'm worried. What I have, is it something serious? The answer for do I have something serious? I'm afraid to say yes, if not treated, or if you don't treat this, you might be in serious or at risk of having serious complication of this. This is a way to address the question of I do I have something serious, because he asked you this question, but you explain not in direct way. So this is the
Mm.
way how to address. Let's to do the counseling about the hypertension.
Mm.
Sorry.
Dr. Basim, sorry, can you
Yeah.
repeat this point because I didn't listen good
Okay. When
about
anyone, any
serious when?
candidate, yeah, do I have something serious? Yes, you can
Mm.
say, I appreciate your worry about your
Mm.
condition. I'm afraid to say, yes, you might have serious complication if you didn't take the medication. By this way, you address the concern, and
Mm.
you give him warning that he might take the medication for his condition. And at the same time, he will be afraid if he missed the medication, he might have serious complication, which is the stroke in this scenario. But
Mm.
before that, you have to ask him if he knows about the AF. He knows about hypertension. She told you about. But the AF, you didn't, or she didn't say that she knows about the AF. How to explain AF in non-jargon way?
Eh.
You mentioned it, but I think it was in jargon. You know how to explain, but try to imagine you are talking to your friend or your family member or your relatives that she's not in the medical field at all. So you will
Mm.
use simple and non-medical terms. So you will not say you have atrial fibrillation, or you can say atrial fibrillation, then explain what is the atrial fibrillation. But he will not know what is the atrial fibrillation. Okay, so
Yeah.
you have a condition called atrial fibrillation. After doing the result, the investigation, the heart racing, you have a condition called atrial fibrillation, in which your heart is beating rapidly and irregularly, and this
Mm.
might have risk to form a clot in the blood in the heart rooms or chambers. And if
Mm.
this clot happen, it might travel away from the heart, going to some blood channel, and it might lead to the stroke. This is the explanation of atrial fibrillation and the stroke complicating the atrial fibrillation, which is thrombosis.
Mm.
Don't say embolus go away, or if you want to
Mm.
say it, okay, you can say it, then explain it. You can you can do a drawing as I draw in the background. You can see in the screen. Simple draw. It's a clot in the blood channel in the heart. It might travel away to the blood channel. Then it will block this blood channel, and you might have the stroke. The stroke happen when the blood clot close the blood channel totally or partially. In this way,
Mm.
so you address the AF, you explain the disease, you explain the possible complication from AF. Now the role of the management, how to manage this. So we are here in the best interest of your condition. You have to take this medication. It's called
Mm.
preventive measure, as you said, or preventive treatment. How to do it? You will take three medication. Try to explain simply how he can take the medication orally, for example, the dose once or twice according to the, if you know. If you don't know, skip it. And to give one side effect for each medication, which is common, for example. So if you are talking about Apixaban, and this is the cornerstone of this scenario, there is medication in the best interest of your condition called Apixaban. Have you ever heard about this medication? No, doctor. What is it? It's one of the blood thinner medication that taken by your mouth, for example, twice a day, and you have to be compliant to this medicine. And I'm afraid to say, whenever you take this medication, you have a risk of bleeding. So please avoid any exercise or heavy exercise or lifting heavy objects or sports with trauma. This is the most common side effect for Apixaban, right? Bleeding. And you give
Yes.
him warning about one of these side effects. This is for Apixaban. You finish? Is it okay for you? Yes, doctor. I will try my best to do. Then the next medication, lisinopril. It's one of the medication lower the blood pressure, helping the blood pressure to be in the normal range, and so you will not have or you will not be at risk for developing these clots. It's the hypertension. It can lead to thrombosis or stroke by indirect way, by any way if you want to mention. If not, there is indirect way to cause a stroke by blood pressure, high blood pressure. Okay, this is for the lisinopril. You can give some side effect or warnings signs for lisinopril, for example, if you have feeling anuria or feeling the water work decreased, please seek medical advice or you follow with your GP. And I guess this is the most common side effect of the ACE inhibitor, right? The patient might have acute kidney injury or uh, increase renal function test, so he might review his nephrologist. He might stop or reduce the dose. The third medication, atorvastatin. Of course, while I'm explaining, I will take time. But if you do it in a scenario, you will just uh, do in one sentence, then skip to the next task. The atorvastatin, one of the lowering therapy of cholesterol. Doctor, I don't have cholesterol. We found that, I'm so sorry to say, we found that you have high cholesterol in your blood, or as you said, it's one of the preventive medication you should take along with the Apixaban and lisinopril. So this medication, you should take it once daily at the evening time, for example, and by your mouth. And the possible side effect might happen with atorvastatin. Everyone know it's myopathy. You might have some muscle pain, or if you feel weakness, please don't hesitate to call your GP. So you give a medication and you give one side effect for each medication. Please be compliant to your medication. Don't stop any medication unless you have medical advice or you seek medical advice. If you have any concern, I will provide you leaflet brochure about this medication, how to prevent further stroke. For the weakness, doctor, I have weakness. Yes, we will refer you to group of specialists. They will help you how to cope with your daily activity. They are professional with such type of weakness. So you are talking about physiotherapy and occupational therapists. They can provide you some tools to help you to cope with your daily activity. What's your job? I am driver. You have to address the driving. Sorry, while you are having this weakness, I'm so sorry to say, you might be unable to drive unless you have improvement in your weakness. So inform DVLA and you will update it when you can resume your driving. Do you smoke? Yes. How many? How for how long? I can refer you as Dr. Salma did. The alcohol, if he's taking high dose or high rate exceeding the limit, please moderate your intake and ask him for concern, support any concern again, and the closure of the meeting. I will provide you leaflet brochure website. If you have any concern, you can contact us. Whatever you want to do at the end. Thank the patient, and that's it.
Mhm.
You understand how to do it, but you need to practice more. That's it. But you know how to do every concern, answering, addressing, and how to ask the patient how to. You have the scheme of the communication scenario, but still need to practice more to make the things more professional. Okay.
Yes. Thank you.
Yeah, see, I explained the old scenario while explaining it takes 12 minutes. So I think if you do it in the communication, it will be less because I explain more detailed. But I believe it will be easy if you do this scenario again and again. You have any concern
Inshallah.
or question, Dr. Salma?
Thank you very much. Thank you.
Okay, thank you also for practicing because the session was about to be cancelled, but you save it and you
I
have
didn't
the
want to cancel.
opportunity.
Yes.
Perfect to do that because whenever
Mm.
you are still hesitant, you will stay hesitant forever. But once you break this this
Inshallah,
fairness,
in the next
yeah,
day I
this
will.
fairness only
Inshallah,
for
I
first
will.
time. Next time you it will
Yes.
be more confident and easy.
Inshallah.
Okay.
Inshallah.
Okay.
Next time I will be. I will
Okay. If you have
practice.
scenario, please you can write in the chat box for Dr. Kinana. We will open the discussion. Or Dr.
Okay.
Kinana want to add any comment?
No, Dr. Bassem, thank you. It's clear.
Okay. Okay.
Thank
Thank you, Doctor. Okay, we can have now the discussion. Anyone has comments or suggestion? Anything to
Really,
be added?
Dr. Basma, yes, did well. Just I'll add some small points, just
Dr.
like
Salma,
technical points.
Salma,
Yes,
Salma.
Salma, yes.
Yeah.
Well
Okay.
done, Dr. Sen. Just
Go ahead,
technical
Dr.
point.
Aisha.
When a patient will discharged and is sick for the last time, so better when you see him, you see how do you feel now. I hope this is hard times going went well and
Mhm.
you feel now better. So you ask about his what he feel. This is a good point for assurance and for empathy and sympathy about his condition because he just come out from a difficult experience. Okay, this is the first thing. The other thing is that the lifestyle modification, it is be a must when you discharge a patient having a stroke or MI or hypertensive episodes, anything like that. You should stress on the lifestyle of a patient of hypertension, that you should like being active and stop smoking. Please take care about your diet to be healthy diet. Please take care about more salt intake and try to reduce this. Be away from stress. We will support you by something called the rehabilitation program. Please be compliant with their appointment because they will help you so much to overcome the next days and to recover. And the next month after this stroke, this is the most important month in to recover and to regain your power and your original status. So focus on the appointment or the exercise they will give to you, or the some like they will teach you something they will do at home. Be aware about it, and with whom you live. Anyone can help you. Come and go to the appointment
Mm.
of exercise doctor. If you need any help, don't hesitate to contact. So this will be
Mm.
very important points besides explaining the medication. As the
Yes.
Dr. Bassem said, you will explain for what this medication and one complication only maybe for anyone. Uh, Also, you will explain first as you did, but in non-jargon way. If you will not, do you aware about what happened to you? You aware why this happened? Uh, we need to take some medication because we found that you have something in your heart like that, and it is supposed this medication 111. And if he said it is important or like that, you will mention, yes, I'm sorry to tell you that your life will be at risk and you may have another stroke if you didn't take this medication. Or
Mhm. Mhm.
Thank you,
no,
Dr.
stroke, not
Aisha.
a jargon. No.
Yeah, yes.
Yeah.
Yeah,
Yeah.
you explain a very important point which I miss. The rehabilitation program, dietitian involvement, lifestyle modification, all these things is very important. Whenever
Mm.
you finish your task, try to address these points. The dietitian, low salt diet, exercise, walking for a couple of minutes every day for 5 days per week. All these things make you healthy and it will help you to regain your power, as Dr. Aisha mentioned. I will add just one concern or one point. It was one of the concern of Dr. Kinana. Shall I take all this medication? It's too much, doctor. there is a solution always for this problem, which is called polypharmacy. So the patient will take a lot of medication, maybe 5 or 6 medication. First, for the timing. So there is application to remind the patient when to take the medication every day. So there is application for reminding. This is the first thing. There is a container or small drawer for the medication. It can be carried with the patient. It would be easy to know what's the medication he should take and what time. It would be written over the drawer. Small drawer, it can be carried in a bag, in your handbag, or it can be during your duty time. It can be attached with you. So there is solution for every problem. Try to address and try to make it easy for him, and try to be sure that he's satisfied with this solution. Is it clear?
Yes. Thank you very much.
Yes, doctor.
Okay. Uh, anyone has another comment regarding this scenario? Thank you again, Dr. Aisha. Anyone want to add? Please feel free to comment. It's not a one-way discussion. It's interactive discussion. Anyone want to comment to gain confidence?
Uh, Dr.
Yes.
Dr.
Bassem,
Bassem,
you
I just
mean, yeah. Tell doctor, it's okay.
okay. Dr. Bassem, you say that there is drawers for medication. What is the drawers for medication? Something like this.
It's small plastic container. You can carry in the bag. If you see the patient at home, they have a small drawer. You can put in every drawer 5 medication or 5 pills for each medication, and you write on the drawer outside the name of the medication and the time of this medication. I will show you
Okay.
in the
It can be also already now they pay it with the days. It is written the
yes,
days above
exactly, yeah,
it. Yes.
days and time. Yeah, you
And
can have
maybe
it with
also
this
there
one.
is someone with times one morning, afternoon, and the evening.
Exactly. Yeah.
Yeah.
I will show
Yes.
you, Dr. Iman. There is a small drawer. You can, or the patient, sorry, can carry it in his bag. Small one, 5 container. Every container will have. You can put one medication separate from the other drawer. I will show
Okay.
you
Thank you.
in the WhatsApp. Okay,
Okay. Thank you.
most welcome. One also solution for the mini tablet or polypharmacy. There is combination. For example, if the patient is hypertensive, there is combination of antihypertensive medication, beta blocker plus ACE or beta blocker plus diuretics, and it will be one tablet or 2 medication in one tablet. So you will reduce the number of the pills. This is also one of the solution. The patient will be having solution for the polypharmacy or having a lot of medication. So every problem you can solve it easily and make it easy for the patient, so he can feel it would be easy for him to cope with this medication and how to take and how not to forget this, because most of the patient either to forget the medication or they will feel annoyed by the a lot of medication taking. They don't want to take a lot of medication. So at least try to minimize and to make it in combination, to arrange application he can remember through it. This is the way in basis how to address this concern. Someone was talking, Dr. Kenan, I think.
Yes. Dr. Bassem, for rehabilitation program,
Yes.
so it's needed here, right? Like
Yes.
MI?
Yes,
Yeah.
exactly.
Because there is hypertension, something like this, or also rehabilitation
MI, I
program
think
after.
it is have a specific name. What is the name? And
It's
MI, it
Cardiac
rehabilitation,
is
rehabilitation.
right?
For the
um,
MI cardiac rehabilitation, here physiotherapy or
Mm-hmm.
rehabilitation for the weakness.
I think
Or
there is specific
lifestyle
name for
modification.
MI.
Sorry, Dr. Aisha. What?
I don't know. I feel that there is specific name in MI.
MI cardiac rehabilitation.
Cardiac rehabilitation, yes,
Cardiac
okay.
program rehabilitation, yes.
Yes,
Yeah.
maybe,
Yeah,
yeah.
like this.
Yes. Anyway, no need to mention the name. You can say only rehabilitation means we want you to be back to your original or your
Yes,
power.
gradually they will support you till you regain full
Yeah, exactly.
recovery. Yes.
Exactly. Okay. Anything here also
And
to be?
for driving, we cannot give time, right? If he said this concern about I'm driving and I have money
DVLA.
from this
DVLA.
DVLA. Mhm.
Yeah. This
I will
patient will
contact
have
and come
weakness.
back to you.
No, he will contact. Let him contact DVLA.
Mm-hmm.
In Europe, they are the one contacting the DVLA, not us, not the doctor. So you will refer them to the DVLA. He will contact them, and they will provide him when and what time he can be
No,
back.
Dr. Basim, we will assist you regularly, and
Mm.
because this point they write it in my feedback, I refer the all subject to the DVLA, and this is your responsibility.
Okay, what was your condition? There is a difference, Dr. Aish.
Yes, he was a stroke and having a vision problem,
Okay,
and yes, and he asked when I'll drive again.
okay. So
I
after one
try to
month,
say
he will stop
no,
driving
he
for
has
1 month.
vision problem. He has a stroke for 6 months now,
Okay,
and he come to follow up, and we found that he still have vision problem. So he will ask uh, how what time I can drive again.
mm-hmm.
I tell him we follow up the regular. If you have any improvement, we can tell you, but it is hard to regain your vision again. I'm sorry to tell you like that. But he
Okay.
insists about saying, so doctor,
Duration. Yeah.
my vision will come again, so I can drive by any time. My children only
Yeah.
3 minutes from home, like that. Because he making this concern about 3 to 4 times. So
Okay.
I ask him, yes, you will contact the DVLA. They have a
Mm-hmm.
specific team in this in your condition. They can reassess you to see if they have any solution about your problem, any improvement in specific car, so you can drive again. This is my reply, and this is wrong.
Okay, what they wrote for you?
They wrote that you refer all the subject to the DVLA, and this not. I'll share maybe this is not their role. This is your duty. Uh, I don't know why, but I think that the DVLA has specific doctors, and but
Yeah, this is my concept also.
no,
Uh,
they tell that like this is your decision, and you will the one assess and then tell the DVLA like that.
okay, what I know, Dr. Aisha, anyone has a vision problem, I will stop him driving and I will refer him, especially those patients with long-term disease. The vision will
Yes,
be
they
affected for
will.
long term.
You will tell him, please tell the DVLA that, and this is
Yeah.
report from me for your condition. He will just contact them by report. After the
Okay.
assessment,
Yes,
the
yes,
doctor
I got
will
it now.
decide. Yes, they'll decide
Yes.
when the assessment, and if there is any change in the condition, they will also make report and contact the DVLA. DVLA will decide about the report, but the
Okay.
DVLA will not. She will, or if this is
Maybe yeah,
to
I
make
got your point.
report like that.
They are not physician. They just need your report as medical physician
I
report.
think they have physician, but only is like not specialized physician. So in a lot of situation don't drive. So the specialized doctor will contact them about his opinion, and also the physician there will see by his experience if it can drive, he will not drive or what.
Okay.
But
So
here, Doctoria, we will say we will assist you and
Yes, it's difficult
involve.
to decide now, but you
Mm-hmm.
should inform the TVLA, and we will assist you
Okay.
regularly. If any
Mm-hmm.
change in your
And we
condition, you
hope,
regain
yes,
your
yeah,
power, we will inform you when you will drive again.
yeah, good. Yes,
but still
thank
they
you.
will be involved, Dr. Aisha, the DVLA, after your assessment.
Yes, yes, they are the one decide after your report.
Yeah,
When
yeah, I
he
got
will
it now. Yes, okay.
take the license
So
again,
you
they
will
will
not
decide.
refer
But
them, you will not refer the patient to them without report. After reporting, you will refer and they will decide. This is what I
yes,
understood.
just tell
Okay.
the patient we will regularly follow up you, and we
Mm-hmm.
will update the TVLA if we will find improvement in your condition.
Okay.
But not the patient who will inform the DVLA, right?
No, he will.
Because some
He
case
will.
he
He
will.
will. The one
Because all
inform.
the
Yes.
case he must, yes. Because في
Dr.
some case
Aisha, you
must the
confused us again now. he will inform the DVLA after my opinion, right?
Yes, but you should tell them, please. He already discharged, so
In
he
all
has the
case,
report.
Dr.
Please
Aisha, in
inform
all
the
case,
DVLA about your
right?
condition. Yeah.
Yes, in all case, the patient who must inform the
Yes,
DVLA.
yes. But about
Yes,
when to drive, this is
yes,
not up to the DVLA. It is up to the
yes,
doctor.
yes. Oh.
I think Dr. Aisha, when to drive back, I think also this is by DVLA because they have rules.
Yes, but they will tell you no. We will follow up you and update you about your condition. If
In
any progress,
contact,
we
yeah.
will. Yes, we will
Maybe in
give
contact
you.
with
Yes,
DVLA. Okay,
we
so
will
it's
inform you. He will contact بقى. If we will inform if any update, he will take this update and come to the DVLA.
okay, but there is
I'll share
contact,
also
direct
the
contact.
comment. Maybe you will.
It's okay, but what I know also, I understood DVLA, they have contact with the patient himself, so they can tell him when he can drive back. If he's free now, he can drive or no. This is their
Yes, and they will ask a report always. Yes.
yeah. It's okay. Okay, thank you, Dr. Aisha. Clear now.
That is
Any
means
concern?
need referral to DVLA.
Yes,
Need
need.
referral.
Yeah,
Mhm.
need. Okay. After your assessment. By the way, any
Not referral, just inform. This is point. Inform. I'll refer no. You must inform the DVLA about your condition and stop driving. These 2 points.
by
Stop
the way,
driving and inform DVLA.
this is what I said earlier, Dr. Aisha, and he said no. So he will inform
No,
DVLA
I
with my
just said sorry
assessment.
for confusion. Just I said about when he asked when I'll drive again. Don't said this is up to the DVLA because this is what I said and they comment.
Okay.
We will follow up
Okay.
you regularly, and if you having improvement, we will give you a report about this. We will update you. Just this.
Okay. We can also review your feedback and the DVLA rules. If someone have, I think I have it as PDF. We will see it. Okay. Thank you, Dr. Aisha. Any concern else, Dr. Kinana?
No, doctor, thank you. But
Okay.
where
Let's
is
go.
my case?
Yeah, Dr. Salma, your scenario. Did you write? Dr. Salma, you can write your scenario.
Yes, yes, I will.
Okay.
I,
Dr. Sarah
I,
wrote, what's the
I will
complication
share.
of AF apart from stroke? The most serious complication is thromboembolic events. So either stroke or ischemia or any showers. This is the most common complication of AF, right? This is clear, Dr. Sarah. But the most common is a stroke. But still, the ischemia might happen, lower limb or any limb ischemia, or any shower to any organs, splenic, mesenteric. It's a matter of thrombosis and embolic showers. Visual problem after stroke, Dr. Isos. Visual after stroke, orthop, orthoptist. What is the orthoptist? Plus DVLA. This is what we mentioned. I work in stroke. Okay, good. The patient is asked to contact DVLA if they still have residual symptoms after 1 month. Then the DVLA will send a form for us to fill. Perfect. So this is the summary now. And this is what always I'm saying. If you have acute event like stroke, you will stop driving, the patient driving for 1 month. After 1 month, you will assess his vision. If there is residual, so the DVLA, the patient he will go to the DVLA and the DVLA will refer form. You will fill it by yourself. I think this is the best answer. Thank you, Dr. Isosa. If I am not pronouncing your name correct. So after 1 month, the DVLA will send a form for us to fill. I think this is the take-home message of DVLA opinion. Dr. Sarah, how to emphasize on the point of non-compliance? Perfect. Any patient taking medication, you have to ensure the adherence and the compliance. he should take it on time and regularly. And you can say, if you stop this medicine by yourself, you might have recurrence of the stroke, for example, or you have recurrence of the AF. And yes, by the way, Dr. Salma said some medication to stop or to regulate the heartbeats. And the scenario wasn't about that. It was about the anticoagulant, not about the antiarrhythmic. So don't say something not written in the scenario. I remember just now. Thank you, Dr. Sarah. But is it clear, Dr. Sarah, for you how to emphasize the point of non-compliance?
Yes, it is clear.
Okay. So you have to be compliant in order to prevent the complication. In the same time, don't stop the medication because the recurrence of the symptom might happen and the next time might be life-threatening. It might threaten your life and it might affect either the brain having a big stroke, even sometimes you might have a coma and up to death if the clot is very big. Dr. Aisha, I think shared for the devil.
I share the scenario in the group.
Okay, I will read it now. Dr. Aisha shared her comment. So address concern, but um, again, very bad handwriting, really. Prepare partial driving decision. Very blunt need to prepare patient for driving decision.
It is the judgment, the one I share about. They said like, I addressed the concern, but I raised saying يعني difficult to saying when to return, requesting a problem to the أو referring the problem to DVLA. Difficult the vision to return, referring a problem to DVLA.
But still, mashallah, borderline. Okay, address concern, but incorrectly, right? Incorrectly
Saying, yes,
raised.
incorrectly saying,
Yeah, raised
for vision to
difficulty
return. Difficult for vision to return, and referred
and
the problem to DVLA.
required the problem to DVLA.
Referred, I think.
Referred the problem to DVLA. Okay. Difficult to assess. Yeah.
For vision,
So yeah, is it you didn't say it's clear to return or no? And he asked you clearly about this point, right?
I really replying 3 times, but he
No,
asked
it's okay.
the
It's
fourth
okay.
time.
By the way, they might hear something he needed. If you didn't
But the
mention,
other, if I share the other comment of other one, he didn't
yes,
DD anyone, and he
this is
didn't mention that.
this is what's called discrepancy. There is
Yes, I'll share
discrepancy
the
between
other
exam.
comment. He already comment also, يعني he write
لا حول ولا
something,
قوة إلا بالله. Yeah,
but
this
he
is
didn't deduct me any.
yeah, this is what I realize. They are not agree in the same opinion.
He's the other one. He said that I explained the risk of driving and how
But
he is
without deduction,
reluctant to
yes.
stop. I reassured him that he can regain to work if he. And he said that good words about what I did. But the other one did like,
لا حول ولا قوة إلا بالله.
yes, you will find everyone have
Yes,
opinion.
exactly,
But what
yes.
I understand from them that I shouldn't ask a patient that the DVLA will inform you.
Yes,
I
okay.
already know
We
that
know
he
now
will
that we
not
know
come
now
to
how to do
drive
it.
till his vision
Exactly.
be back, yes. So
So
I'll
you
tell him clearly that, and if he insists, I'll repeat if he insists also.
so you can stop him by yourself. Stop driving. This is for your safety and other safety. And if he insists, as written in the chat box, so we will contact the DVLA, or you can go to the DVLA and we will update them, and they will update you when to drive back according to the assessment in this way. Okay.
But according to our assessment, because already we
Yes,
assessed
our
that the vision not come. Yes.
yes,
So,
our
yeah.
assessment. Yes, I
Yes,
got it.
yes.
Okay. Thank you, Dr. Aisha, for sharing this experience and feedback. Now your scenario, Dr. Kinana.
Yes, doctor.
I'm sharing to the chat box down. Yes, you can see it now. And I will read it quickly. Try to be ready within 1 or 2 minutes. You are senior house officer in the nephrology clinic. Mr. David is 55 years old, known case of polycystic kidney disease. He diagnosed with it about 10 years ago and was only on lisinopril for high blood pressure. His kidney function continued to deteriorate. Now he is on failure and was on dialysis about 2 years. His son decided to donate a kidney for his father, and he is willing to do that. Please talk to Mr. David about the transplantation and need to take immunosuppressant afterward and the effect of medication on him. Okay.
Okay, I can start, Dr. Bassem.
I prefer to write or to put some scheme, what to do, what to follow, because it's complicated. A lot of tasks
Yes,
on this
yeah.
slide. Okay, if you're ready, we can start. No
Yes,
problem.
yes. Yeah, I can.
Okay, here you go.
Hello, my name is Dr. Munif. I'm the doctor in the kidney clinic. Can I confirm that I'm talking to Mr. David, 55 years old? Hello, Dr. Salma.
Yes.
Yes,
Yes.
Hello, Mr. David. We are here today to discuss some issue regarding your health condition. Is that right?
Yes. Okay.
Yeah, Mr. David, do you need anybody to attend this meeting with us?
No need.
Okay. Mr. David, can you tell me how much you know about your health condition?
I have polycystic kidney disease for about 10 years ago, and now unfortunately my kidney is not working good. So my son will give me a kidney,
Okay.
and yes,
Is-
and they tell me that after transplantation we need to take some medication. So I don't know about it. Can you explain
Yeah,
for me?
yes. Thank you, Mr. David, for sharing that with us. And yeah, you already shared your idea about our meeting. So yes, you are right. We are here today to talking about the transplant the kidney for you. And do you need from me to explain more about your condition, or you know everything about it?
Yes, explain for me, please.
For your kidney disease, do you need from me to explain about the polycystic kidney, or you know about it?
Yes, please. Yes,
Yes,
please.
yes. Mr. David, this medical condition and this running in the family. So medical condition, there is a problem in the kidney, and there is multi-sac in the kidney filled with fluid. So it's uh, starting in one kidney to another kidney sometimes, and also affect the function of the kidney as happen with you by the time. And unfortunately, that happened with you, and you need for dialysis and you starting that from 2 years. And after that, also the functions is deteriorate, and you need also you have a complication for this condition, like high blood pressures, and sometimes a lot of complications. We are here today to save to talk about how we can save your functions, your kidney functions, and to how to help regard this problem. Are you with me, Mr. David?
Yes, I'm follow you.
So So, unfortunately, when we arrive to this end stage of the function of your kidney and not working well, you need to transplant. You need to put it kidney from any donor out, somebody to give you his kidney. And the good news that your son, he is a good son, and he's accept to do that, because sometimes it's need time and less for to wait for to have this kidney. And are you with me, Mr. David?
Yes, I can be normal after transplantation. I can
Um,
live
yes,
life
yes,
like normal.
I highly appreciate your concern, Mr. David. First of all, for the transplantation, it's need a test to make if it's acceptable or no, and that a good news that your son have this acceptable point, and he don't have the kidney problem, and for sure when test him, we find that. So he is suitable to give you this kidney. And for you, after taking this kidney, it must put you in a surgery. So it's it's also a big surgery. So it's also need a treatment to make your body accept this kidney. Are you with me, Mr. David?
Yes,
Yes.
thank you.
So yeah. So when you did this surgery, and they will put you, the team of kidney transplant, put you in a multi. Treatments, multi medications. Actually, it's not one, or maybe one or two or three medication, and all of these medications make your immunity low, to make your body accept this new kidney. Is that clear to you, Mr. David?
Yes, you mean this medication is not good? That mean will reduce my immunity?
And no, it's good because it's needed, and it's we cannot make this surgery and put this kidney without this medication. This medication, like any another medication, have side effects, but it's actually needed to make your body accept. So if we will talk about the side effect for this one of this medication, like steroid, it's what we call cortisone. It's have make maybe also affect your blood pressure, or your blood sugar, or affecting your tummy, or something, and also your skin. But it's actually, when we put the side effects in front of the effect, or what its importance for this medication, it's nothing. So also there is another medication, it's need like cyclosporine, also tacrolimus. It's yeah, it's a lot of medication, but as I tell you, there is side effect for them. But
But
when
this
we
is
put
too
it,
much
yeah.
side effect. This is too much side effect.
Actually, look, yeah, I'm highly appreciate what you said and how you are afraid. But we must be, yes, clear here in this point, because this side effects, we can manage it by regular follow-up. And you must be aware about, you must be careful about your medication, and any another medication you must, any doctor we will write for you, because there is like intra-indication or contraindication without this the medication. So you must be aware about all the side effects, and you must be aware about if there is any like something happen with you, any symptoms, abnormal symptoms, to direct seek medical advice, because this really needed, and save this surgery, it will save your life. So actually, we need it to save your life. Am I clear, Mr. David?
Yes, yes, okay.
Okay. There is any another concern, Mr. David?
This is I can stop it one day or need to take it for forever for life.
Yes,
Two
thank
minutes
you
left.
to asking. Yes, thank you to ask this important question. So this medication must taking for life, and you cannot stop by yourself. Sometimes the medical team will make for you adding medication or something, but it must be by the transplant team. Doctors will follow up you and take care about every point of this one. And you must also follow a dietitian because there is some food or something must be aware about it. And also Mr. David must be aware about alcohol. Do you drink alcohol, Mr. David?
Yes, minimal.
Yeah, so
Okay.
I'm sorry to tell you, you must stop drinking alcohol, and because as I tell you, they interact with the medications. And do you smoke, Mr. David?
Yes.
Yes, also, I highly advise you to stop smoking, and we can help you regarding this issue. And as I tell you, Mr. David, there is a regular follow-up with you about this point. There is a consent to do this surgery. You will read a lot, all of this detail. We're talking about it in the consent, and they will we will try to explain every point in details if you need. And also you must, as I tell you, be aware about also the surgery side effects, as any big surgery it will do. But as I tell you, it's important in your case, and we are here to help you if you need any help regarding any point. Am I clear, Mr. David?
Thank you. Yes. Thank you.
Yes. There is any further concern, Mr. David?
No, thank you.
So, Mr. David, I will give you some brochure and leaflet to read about a kidney transplant, to read about your condition and also the medications. And there is for sure contact number. If you need any help, don't hesitate to contact us. And I need to appreciate that you have a good son to help you in your condition, and we are here to help you.
Okay.
Thank you very much.
Thank you. Thank
Thank
you,
you.
Mr.
Well
David.
done, Dr. Kinana. Perfect.
Thank you.
Really, you did this scenario well. So we
Thank
can
you.
hear from Dr. Salma comment. Then I will comment. Dr. Salma.
Dr. Basim, I am still
Okay. I
I'm
get it. Okay. I will comment on
I'm
here.
a
Okay.
student. I'm a student.
No worry, no worry. Even at least you know that
All
the
of us, yeah,
yeah,
Dr. Selva.
yeah. If you know the idea of
Thank
scenario,
you.
tell us what she do or what she should
Yeah,
do, and that's it. And I will comment. I will give her my comment on it. So
Okay, thank
if she did the task or she need to explain more to do something, which is you hear from a mentor, of course, this scenario. Anything she missed, any important point she skip like this. If not, I will comment on her performance. What do you think? Did she cover the whole point of the scenario, Dr. Salma?
Yes, I think yes. يعني good then.
Yeah,
Good.
okay. So let's start from the beginning as introduction. I think Dr. Kinana covered the all points. The introduction about also, I prefer not to ask someone to attend the meeting with genetic condition.
okay. Yeah,
Yeah,
I'm
yeah,
state in this point, but I feel
yeah.
maybe he needs help from his son or something like this. Sometimes they do like this. If there is transplant or something, I
Yeah,
don't know. I heard this
and
one before, so.
yeah, it's okay, but it's
Mm.
I think for the infectious disease or sexually transmitted disease, and for the genetic condition like myotonia dystrophica, some disease like Huntington, some disease the patient himself doesn't want anyone to hear about it. Embarrassing to know the other know about his condition, right? So
Yeah.
it's like that. But in
Mm.
this condition, because of his
Mm.
son already know
Yeah.
and he want to donate his kidney, so it's okay if you can invite him, the son, I mean.
Hmm.
Anyway,
Yeah.
this point will not make difference. I think it's okay to invite someone to here, and because he's going for major surgery, which is renal transplant. I think this scenario carry the task of explanation of procedure or surgery, renal transplant,
Hmm.
how to prepare, and so you have to talk about the pre before, during, and after. Uh,
I must talk about the surgery, right? I
yeah,
forget to.
yeah,
I didn't
exactly.
talk about surgery.
Yeah, you talk
I
about the
feel all. Mm,
immunosuppressant
yeah.
later, yes, but there is surgery. It will happen. A patient
Mm.
will undergo anesthesia and the preparation. He already have the donation, so he's going to be operated and receiving his.
Also, here I'm thinking about his son. He's maybe not the good choice for his. Maybe he have some like this disease because autosomal dominant. So, but it's too much to talk in.
Yeah, it's not the
Yeah.
task to tell the
Mm.
son, no, don't donate, or you have the
Yes.
disease, or no.
This talking
Already,
with the father. Yeah.
exactly.
Not.
You are talking to the father, and the son
Mm.
already he has been tested if he can
Yes.
donate or no.
Yes.
If you are talking to the son, the scenario will be totally different. You will talk about
Different. Yeah.
exactly. We have to screen the son before talking
Yes.
about the donation. But
Yeah.
this scenario is about the father, and the father will receive the kidney which already agreed by the team to be donated from his son. So nothing to be advised regarding this. Either the son is okay, there is a matching or no. This is not our concept.
Mhm.
But to be in the same family or genetic patient related, so it would be more matching rather than the non-donor or non-relative. So let's talk about the procedure itself. Patient will be prepared. He will be tested for bleeding profile, the also hemoglobin, for all the profile before surgery. A patient would be admitted before the surgery to be prepared well. There is a consent form, of course, for major surgery. He will be signed. This is before. During, the patient will be shifted to the theater room, to operation room. He will be sleepy or semi-sleepy, but I think he will be deeply sedated or sleepy, so he will not feel anything because this is a major surgery to open his tummy with the incision. He should be under effect of anesthesia, so he should be sleepy. Then the during the surgery, the transplant team will come. They will take the kidney from the son, putting in his tummy. Don't explain more about the surgery itself because we are not familiar with it, and this is not our task. The task now will be more focused on the post-operative. So what will happen post-operation will be monitored within the first couple of hours. He should be closely monitored for the blood pressure, for the vitals, and for possible side effects. Sometimes the rejection might happen early or late or whatever, bleeding, injury. So he should be monitored and admitted. Now, after of course, you have to mention the complication. So 2I, 2B,
Yeah.
bleeding and perforation, and the other one is injury and infection for any procedure or for any surgery. So there is risk, but we have professional team. They are expert. They did this surgery many times, and now the time for the post-operative management. How to deal with this patient post-operatively. He will take medication to keep these kidneys implanted for a long time. So you have to be compliant to this medicine. It's called immunosuppressant. As you mentioned, one of them steroids, but you don't know the others. It's not written, right? But at
Mm.
least give idea that this medicine or this medication will make your defense system low in order not to attack the new kidney. Why? Because we notice after the surgery, a lot of patients having what's called rejection. So their system or their defense system will attack the new kidney, and it might fail the surgery. In order to prevent this, you will take this medicine. What the possible side effect of this medicine? Your defense system will be low. You might catch any infection. Please stay away from any culture or popular places, crowded areas, to take some vaccination, and to be away from the sun for the cancer prevention also. Others like the steroid, as you mentioned, the side effect of steroid, you can give briefly. There's some steroid related side effects specifically for steroid. We can update you in another meeting about this side effect because it need another meeting. Steroid as side effect need to be separate task, not as post-operative along with the surgery, along with the transplantation. At least give him some safety netting, warning, alarm sign. If you have fever later on, if you have reduced your water work, if you have severe tummy pain, if you have a change of your tummy tenderness, or you have any tummy sensation, different sensation, don't hesitate to call us, and the transplant team will follow with you. Provide him, as you said, leaflet brochure about the surgery and the possible side effect of the immunosuppressant. This is in general the scenario, but I think you cover a lot of them apart from the consent and the surgery, right?
Yeah, I said at the end about the consent and the
Yeah,
surgery, but I must
perfect.
take before. Yeah, talk
Yes,
before about
exactly.
the
In
surgery.
order.
Yeah,
Yeah,
yeah.
do it in order, before and during and after.
Mm,
Okay.
You mean for
okay.
immunosuppression need consent
Surgery.
No, the
for
surgery.
for surgery? Okay, okay, okay. Okay.
Yeah, okay. Clear now for all?
Yes.
I can see some comments. Anyone want to comment first, verbally?
Just one point about here, you should giving the benefit and the also the risk of rejection you should mention here. The benefit, you will benefit from this surgery that you will depend on this kidney. You will not require dialysis anymore after that. So it is a very great benefit. And but the problem that we have also this kidney, if you have this kidney, we didn't give you 100% sure that your body will accept it. And there is, I'm sorry to tell you that there is a small percent that maybe this kidney will not suitable in some patient. But for that, we making all taking all action to let your body accept this kidney in the form of that you will need to take long last or daily medication for your life. The most important point that you will tell him that he will take tablet for daily for all his life, long life, because this is important point, and they mention it in the scenario clearly that he need medication for long life, and this is one of absolute contraindication or relative contraindication in transplant kidney. The patient not aware about, not compliant or not aware that he can take maybe Dementic or something like that, he will not take the medication regularly. So this is one of relative contraindication. So he should accept that he will take daily medication for all his life. This is all. And one of complications that surgery that we can having also that operation not successful, that unsuccessful operation or unsuccessful surgery, that hyperactive rejection or hyperacute rejection, hyperacute rejection. I think Dr. Bassem, no time to explain surgery. It's not our.
No, it's not.
Not,
Yes, this is for the question in the chat box. Yes, no time to
yes,
explain, and this is not
not
our
time.
task. Yeah,
Yes,
it's
so just
surgery.
this surgery need, as you said,
Yes.
general anesthesia, and
And
you will be in hospital for some days.
yes, exactly.
Yeah.
To monitor you and the kidney function and the urine
You can
output.
tell also they will put this kidney in your tummy. I think only this point about the
Yes.
surgery. Mm.
Simply, yes. I agree with that. Okay, thank you, Dr. Aisha. Well done, Dr. Kinana. Any comment, Dr. Kinana, Dr. Salma, any question?
Very good by This
Yes, it
is very
means
good, Dr. Kenana, really, your way and your approach and
Thank you.
confident.
Thank you,
All,
Doctora. But
mashallah.
sometimes, but I'm return the same maybe when between my sentences
no,
I
no,
say
it's
the
okay.
same, right? It's okay.
It's
Sometimes
okay.
I say the same. Am I clear? Are you with me? It's
No,
No,
no, this
no,
is
this is good.
yeah.
You're good.
yeah.
It's
You should do
Yeah,
this.
it's good. Yeah.
And by the way, with the time, you will be more professional and expert.
yeah. And sometimes I'm return the same explain. I explain for her twice about how it's important, but the same. I talk the same sentence, then I come back to the same idea. So yeah,
No
must be
worries, no
maybe
worries. It would be
more. Yeah,
it
So,
would
yeah,
be
Dr.
solved.
Kinana, better to write a scheme for you. You
yeah.
have already
Yes.
5 minutes before
Yes.
in the exam. Write a
Mhm.
point and like making a mark when you finish one point, so you will not return back to it again, and you will be systematic, and also this will
More. Yes.
give you more confidence when you talk, and you will not miss any
Yeah.
point till the patient concern it.
Yeah. I forget about the infection, so I didn't inform her about infection. Yeah.
Remember both eyes, both P's. Remember them. Two P's, two
Yeah,
eyes.
yeah, yeah. I did for surgery. I at the end I remember to talk about the surgery. I feel my task to talk about the medications and how she take care about after.
You cover most of them, by
Yeah,
the way. You
yeah,
cover most
yeah.
of them. So I just need to practice more, and you will solve this
Yes, yes.
repeating
Thank you.
issue. No worries. Okay,
I
thank you,
think
Doctor.
here main task is immunosuppression, huh?
Yes, this
Main
is the
task
medical
immunosuppression.
point of view.
Yeah, like
Yes,
this,
It's
what
not
I
yes,
surgical.
understand.
But
yes.
Mhm.
you should talk about the consent because this is surgery. Then you can talk about the immunosuppressant, but not in names because it's not specified in the scenario. You can give examples, as Dr. Mikanana did, with the common side effects for each without going deep. If he has concern, if he's worried about some medicine he knows about or he read about. And by the way, immunosuppressant in general, they can have what's called general side effects, like infection, of course. Any immunocompromised patient is at risk of infection, and the cancers. It might be precancerous for skin cancer or basic or whatever. So you can give some precaution regarding this issue because it's not related to one medication. It's related to all immunosuppressants. But there is a specific side effect for each medication. For example, tremors with tacrolimus, steroid, cochinoid, and the side effect of steroid, high blood pressure, high blood sugar, skin bruises, and cataract, and so on, psychosis, vascular necrosis, osteoporosis, gastric ulcer. All this would be in one session. Steroid could be a separate task, as I said. Cyclosporin, high blood pressure, kidney impairment, or hypertrichosis, hyperkalemia, and so on. So you can give the general side effect of immunosuppressant, which is infection and cancer, and one simple and common side effect for each medication separately if you have time. If you don't have time, provide him with leaflet brochure about the possible medication and the possible side effects, and we'll let you know more in another meeting how to take this medication and how to take care, how to be careful about the side effects. At the end, social support quickly, alcohol and smoking, the job, of course, and support if he needs, and thank the patient. This is the way to do it quickly. Okay?
And always, Dr. Kinana, when you mention the complication or side effect of medication, as you said, but at some point, you said already that the benefit that we take from this medication is more than the bad effect that
Yes.
we expect. And it's not happen to all patients, and with good follow-up, just this point, with good follow-up
Yes.
and the management
And
and
not happen for
compliance.
all the patient. Yeah.
Yeah, and with good follow-up and with the specific, we have special team for this transplant. They will educate you and manage you and follow up you regularly, so we can like predict or knowing the bad effect early and manage it accordingly. And it is manageable bad effects, so we can manage if happen. This is
Okay.
reassuring the patient. Yes.
Mhm.
Yes,
Thank you, Dr.
perfect.
Raj.
Thank you, Dr. Aisha. Perfect. Yes.
Thank you.
Thank you, Dr. Kinana, as well. Thank you, Dr.
Thank you.
Salma. Yeah. I think there's some comments. I will try to read quickly. Do we need to talk about? Yeah, we already talk about this. Technical in the steps, no need. Just the preparation and the day of the surgery, how he will be sleepy or no. Because some patient will stuck with you, doctor. Oh my God, I will feel this pain. I'm worried, doctor. I don't want to do the surgery because of you are going to open my tummy. You'll do surgery to my tummy. I can feel pain. Oh my God, this is so horrible, doctor. So in order to assure him, better to start saying you will be sleepy and you will not feel pain from the start. But the steps of the surgery, this is not our concept at all. This is a transplant issue or nephrologist task. You will be on, yes, lifelong medication, of course, and immunity, as Dr. Aisha said, this is defense system in non-jargon way. Okay. Thank you, Dr. Kinana again, and Dr. Salma. Any comment?
Thank you, Dr. Sami. Thank you, Dr. Bassem. Thank you.
Most welcome. Okay, any
Thank you.
question, any comment from others? Okay, so we'll see you tomorrow with long clinical consultation. Good luck and good night. Assalamu alaikum wa rahmatullahi wa barakatuh. جزاكم الله خير دكتور سالم.